So I'm Terry Kemple. I was a GP in Bristol for 30 years. I've got various green roles. I'm not a climate change expert. I am from the generation that made it oh so much worse, so sorry about that. And now I'm frustrated by a lack of urgency changing our behaviour. Now, on my illustrated CV on the right, it says, get to the front and hold your arms up in the air and scream. And I heard that the best 2 o'clock speaker ever. I'm not as good as him, but that's what I'll try and do. So in life, get to the front, hold your arms up in the air and scream. Behaviour change is important. It's a bit tedious, but it's important and has to be done. So what can GPs do in their practices? The RCGP's got a net zero hub, which I'll talk a little bit about at the end, but mostly I'm going to be talking about our toolkit in a roundabout way. So what do we need to do? We need to mitigate to avoid the unmanageable. You know, we all know about reducing our global greenhouse gas emissions, but now more and more and more, we have to adapt to manage the unavoidable consequences of climate change which are coming our way. So you know all about mitigation, I won't talk about that. But with adapting for climate change, we heard this morning that in the UK we're going to have more frequent and worse flooding, and 10% of our hospitals are already in a flood risk area, and 7% of our GPs are in flood risk areas as well. The good news is it's slightly better than Wales and Scotland. 4.6% of all our UK emissions, we know that. These are all things that you know by now. And you know we've got really ambitious targets for net zero. I'm not quite sure what's going to happen if we don't hit those targets, but we've got the targets. What you probably don't know is that 20% of NHS carbon footprint is from primary care. What you also probably don't know is that roughly 30 million appointments per month exist in primary care, compared to all A&E, that includes minor injury units and things like that. They have about 2 million per month, and all outpatient appointments in hospitals, which is about 10 million per month. So it's a massive, massive patient contact. And actually that puts general practices with their toe in every community and a great influence on the community, so they can be great vectors for actually bringing about much change in our attitudes towards climate change. You've seen this before. Primary care is those little, the arrow number 1, and most of it, our carbon footprint is from medicines and chemicals, and meter dose inhalers as well. I'll talk about that, and the rest is patient and visitor travel. 60% of our carbon footprint is just from the treatments and our clinical work, which we have some control over, but we haven't got control over the packaging of pills. So we do need to reduce over-investigation, over-diagnosis, and over-treatment. This is much neglected by the mass of the healthcare industry. We know from the US that medical services that do not improve patients' health account for 10 to 20% of US healthcare, and UK is not that far behind. We also know that at least 10% of the current volume of medicines we give are overprescribed, and it's probably more like 20%. And we also know that clinicians constantly overestimate the benefits of their treatments, and that the overestimators are more likely to use the treatments inappropriately. So these are issues which can't be ignored. They're included in the toolkit, but this whole area is a different lecture. So back in primary care, the carbon footprint, our sources are, as I said, around 60% clinical. If you take one thing away from today, it is that 13% of that is due to metered dose inhalers in respiratory conditions, asthma, COPD, things like that. And most of that is from the propellants in the metered dose inhalers, which can be 2,000 to 3,000 more potent greenhouse gases than carbon dioxide. So what we have to do is obviously change our care so we have better propellants in the inhalers, which the industry is rushing to do, or use dry powder inhalers, which have a much smaller carbon footprint. And the other thing I want you to take away from this today is never, ever, 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 ever throw your metered dose inhaler into domestic waste, because if it goes into domestic waste, 25% of the propellant is still in it, and it's going to leak into the atmosphere. Return it to the pharmacy where, if you're lucky, they'll recycle it, but more likely they'll incinerate it. The non-clinical carbon footprint is probably more or less as you'd expect: electricity, gas, staff travel, patient travel, business services, goods, stuff like that. Until recently, of course, it was all lumped in there. We wouldn't really know this at all. But fridges is 27% of our carbon footprint. I mean, who knew? And most practices don't know this either. So the problem is, lots of our practices have got no control over their electricity and power usage in their practices for various reasons which I can go into. So we need many doing everything possible rather than just a few doing every impossible thing. So the reasons why we don't do more, well, there are just a very few people who don't think it's happening, but they're still out there. There are lots of people still in the health service who don't think it's relevant to their work and it's somebody else's problem. But the vast majority they just really don't know what to do about it. But there are other reasons. Gus Seth, who's an American environmentalist who's about the same age as me, thought that these problems, biodiversity loss, ecosystem collapse and climate change, we'd solve those after 30 years of good science. But now he believes we have to take into consideration selfishness, greed and apathy, which we can see every day reported in the newspapers in one way or another with North Sea oil licenses and things like that. And what we really need is spiritual and cultural transformation, but we just don't know how to do that. So, in face of that, we all need relentless, stubborn optimism, this is Christina Figueres' words, and avoid those wonderful things: environmental grief, climate depression, eco-anxiety, futilitarianism, and just being a doomer, which are quite common. Anyway, it sort of makes you stop and think, I hope. Okay, so in general practice, how do we improve, protect planetary health? What can we do about it? Well, the important thing is we have to understand that low carbon is the only direction of travel. There is no other direction of travel. That's the only way forward. And it's going to be better for our patients, the population, the planet. We know that. We just have to make other people realise this. But mostly in healthcare, people don't have the knowledge about what to do. How do we mitigate and adapt in our everyday work and at home? Most people don't know what to do. And to put that in context, at the end of 2021, we did a pilot survey in the southwest of England, which we got permission to roll out to the whole of the rest of health education England areas. 3 regions took it up. The others weren't really bothered about planetary health at the time. And these are of all the ones these are the best results, and these are the most climate-friendly results. All the other ones were worse. So 1,600 GP trainers and trainees and educators in the southwest, 14% response rate, typical for a sort of discretionary survey. There are lots of questions, but the take-home message is that 70% of these enthusiastic people who responded had no planetary health learning or training. 80% felt they had insufficient learning and training. More than 50% weren't aware of the 3 main resources which were easily available to them, and 25% weren't aware of any GP resources available to them. That's part of the scale of the problem. So the other 86%, who knows what they think, but it's probably a lot worse than that. And that's the educators. So for every problem, there is an answer that's clear, simple, and usually wrong. So back in 2014, when Bristol had been appointed European Green Capital, Remember Europe, for 2015, a number of us came together, and actually it was one of the best moments I've had in this sort of personal journey, because everybody brought a different part of the jigsaw piece together, and because we all pooled our resources and we weren't really aware of each other before we had this initiative. And we came up with the Green Impact for Health Toolkit. And the idea of this is we answer the question, what can we do in our practices? Because prior to this, there's no guidance at all. Okay? And we came up at that time with over 100 actions that say what you should be doing, why you should be doing it, and how you should be doing it. And every year since then, we've improved it, and we've improved it, and we've improved it. So it's a lot better than it was right at the beginning. As one example, when we started it, nobody had ever heard of green prescribing or social prescribing. Nobody had ever heard of those terms just 10 years ago. So what can GPs and staff do? Well, there's obviously individual actions. When you target somebody, a worker, then they're going to start thinking about what they do at home as well. But there's also their work-based actions, non-clinical and clinical, and also a role certainly in general practice is educating others and being role models in their community. If they see the doctor cycling down the road, it has an impact on them rather than if they see them driving in their Jaguar down the road. So when I'm in an audience like this, I usually ask, have you checked your carbon footprint? So just put your hand up if you've ever checked your personal carbon footprint. Right, that's the best response I've ever had, okay? Usually if I'm talking to a group of GP trainers or something like that, there's 4 or 5 people, 2 of whom actually invited me to talk. But if you've never done it, it takes about 5 minutes. There's lots of very simple calculators. I'm going to plug the ukhealthalliance.org carbon literacy guide. It's a list of frequently asked questions that will point you in towards the easy to use guides. The first lesson is, what's the volume of 1 ton of carbon dioxide? It's roughly the same volume as a normal size hot air balloon. That's the volume of a ton. And the weight of 1 ton of carbon dioxide is roughly the same weight as a female adult giraffe. So I don't think you'll ever forget that now. Back to our work-based actions. So you have to decide what can you do in your general practice. You can use this free Impact for Health Toolkit. And importantly, you should be adding sustainability to the agenda of as many meetings as possible. There's another toolkit, My Green Doctor in North America, and their experience is if you don't do that, what happens is they create, sorry about this, green teams, and the green team are then the only people in the organisation who are responsible for anything green. It's not part of the organisational culture. So it has to be added to the agenda of the meeting so it's raised and people can start thinking about it and start discussing about it. It's very important. And with our patients, what we need to do is share the decision-making with them and get their informed consent. That's a general medical council requirement, okay? But we don't do it. But that's what we need to do to make sure that they're on board with what we're doing, because we're not talking about rationing their care, we're talking about optimising their care. And we can use, is it good? It's good for the patient and good for the planet type thing. This is good for the, I'm giving you a dry powder inhaler, it's better for you and it's better for the planet. So the original toolkit on its original website ran from 2000 to the end of 2022. And by the end of that time, we'd gradually increased the numbers of people that were using it. We got rid of the people who hadn't done anything for 2 years, and we had 1,500 UK practices. That's about 50% of all UK practices, and it had about 2,000 users. On the one hand, that's sort of all right, but the 2,000 users means that's one person probably struggling in those practices to do everything by themselves, and that just doesn't work. You need a team approach to it. This is what the original website looked like. There are tabs, the coloured tabs there on the left, covering areas water, prescribing, travel and exercise, quality improvement, zero carbon, news and communication, food and drink, vulnerable groups, energy saving, healthy planet, waste and recycling, learning, social prescribing, and a few extra ones. So that's the various things that people can look at. And the good thing about the toolkit is it's free, completely free, it's easy to use, it's designed by GPs for GPs, that includes practice managers when I say GPs, improves sustainability, saves you money, and that's recurring money, that's the best sort of money to save, and had a good independent review. The independent review was earlier this year in family practice, and they reviewed all the toolkits and other tools that could be used in primary care around the world that were in the English language. And our toolkit and My Green Practice came out as the best rated toolkits to use. They did make suggestions for improvement, which was very helpful. We were already doing some of these things. More information about implementation, carbon footprinting, hotspots, return on investment and evidence base. The ones that we couldn't do, we hadn't done, we are doing, and some of the other ones, the evidence base is tricky because it takes 3 years to get a good evidence base for that. But there is now a NIHR-based research study which has started at Warwick University. Because what we want is for our family practices based in their communities to be a triple bottom line practice, okay? Working for profit, the people and the planet, because GPs based in the communities can have a real impact in their communities and they can see it very quickly when things are improving. From that same paper that was I talked about a minute ago, they came up with some barriers and facilitators. Again, leadership that values environmental sustainability, there's not enough of that. Workplace culture that values environmental sustainability, there's not enough of that. Education of staff regarding environmental sustainability, not enough of that. lack of awareness, you need to know the benefits, reduced costs, improved efficiency, better quality. And then, of course, there are other barriers which we're all familiar with: lack of knowledge at management level, lack of understanding among staff about the rationales, inconvenience of some initiatives, waning of staff engagement over time, and in some infection control concerns because there's a murky area surrounding personal protective equipment, PPE. So this is a new web platform, and if I gave the old platform sort of like 7 out of 10, this is like 12 out of 10. It's way, way better. It's got much greater functionality. Most of the criteria are the same. There's a few added each year. All the links are updated and information is updated each year, but it's way, way better. Much easier, much more flexible. You could give me something and I could put it in this afternoon. This is the home page. There's a little 5-minute video that tells you how to use it. It's easy to register. The first person that registers in the practice puts in the practice information, takes about 5 minutes. Subsequent users just pick their practice from the drop-down menu, and then they're registered as a user, and then they've got their individual dashboard, which is just for them. On that individual dashboard, there's a bit of information with shortcuts to those tabs that I showed you on the old toolkit, or the old website, plus a few extra ones now like carbon hotspots and cost hotspots. And then below that, there's starred actions, which are practices and say, look, everybody should pay attention to this. We want you all to see this and make progress with this. And there are assigned actions, so you can give some tasks to different members of the group to do rather than others, because there are clinical and non-clinical areas which need progress. The bottom there is the actual progress. There are different levels that people can go through regarding the points you get for each thing. This is my old practice in Bristol, and you can see they've achieved gold, but they've got some work to do before they get to platinum or diamond. And diamond is, I am now a net zero carbon practice. And then there's a league table for a bit of competition at the top there, which shows you which are the top practices. I'll just read them out because they might be in your area. Frome in Somerset, Marloke in Brighton, Family Medical Group Dundee, Colbeck Surgery, the Widow Surgery Bideford, Cairn Medical Practice also in North Devon, Oak Tree Surgery, Narrowcliffe Newquay, and Newquay Health Centre, and then Hawfield in Bristol. Lots of different filters which allow you to pull out different things out of it. I won't go through them all, but these are on the toolkit. These are the various criteria, and there's more than 100 of them. The filters allow you to keep track of what you're doing, different levels, and all the rest of it. And the criteria tells you what you have to do to establish this. It then also tells you why you should be doing it, and then tells you how to do it, and then any other useful information that you might like to do. This is the bit that the actual practice fills in. You can actually put in text, a photograph, or any other attachment. It's not supposed to be bureaucratic. You could, if you want, say, I have done this, tick. So it's fairly simple to use. If you want to know everything that's in the toolkit, you can download it all as a spreadsheet so that you can take control of it, and there's also lots of other resources that you can do. The RCGP has a net zero website. The journey for the RCGP started a few years ago when it said it was going to do something. Quite honestly, it didn't do an awful lot. But if we start in January 2023, it got money from Greener NHS, and set up an online learning environment for learning modules, practice decarbonisation guide, and links to the Green Impact for Health Toolkit. In February, the Green Impact moved to a better web platform. In April, there were 50 primary care development advisors were trained in carbon literacy, carbon footprinting, and individual practice decarbonisation, and can manage, subject to local funding, the delivery of a net zero primary care development support. And by September, they've done a bit, but not an awful lot. So how's the great transition going for you? So you can be part of the solution, not the problem, but GPs will say, well, how do we do when we've got all this to cope with, all the workload, ageing population, all the rest of it? What can we do? You just have to start. You can just take one step, one patient a week, the first patient on a Monday morning, and then add sustainability to the agenda of your meetings, and then see how it goes. Now, if anybody wants a spreadsheet of the contents, I'm happy to share that with you just to see the sort of stuff we're doing so you can save time rather than reinvent the wheel. And it's on the home page of the thing, you can see my address is down there. And if you want your own speciality kit, you can get one for yourself. The SOS Green Impact has already got 10 hospital trusts that have used this model. GPs are using it. Dentistry has currently got their own. Primary care in Wales, which includes optometrists and pharmacists and dentists, has also got one. And you just email Rachel Soper, and her email's also on the front of that homepage. But the most difficult thing is persuading people that a different way is possible. That is the difficult problem. So I ask at the end of this, why do most people ignore the climate change warnings, and what can we do about it? And if anybody's got a good suggestion, please let me know. And we've seen this one already. Thank you.